Women's Health Week. Okay, ready? Yes. Okay, we're live in 3, 2, 1. Okay, good morning, everyone. My name is Gina. I'm from University Health Services, and today we are here with Dr. Mary Landry and Marta Staple, who's a nurse practitioner, and they're both here from the UHS Women's Health Clinic. And so, in honor of National Women's Health Week, they're going to be doing a little bit of Q&A with us. So feel free to comment your questions, or you can also, we have our messaging open as well if you would rather privately message us your question, and we will answer those for you. So would you like to introduce yourselves for everyone?
Sure. My name is Marta Staple, and I'm a nurse practitioner here at University Health Services. I'm certified in women's health, and I work specifically in the women's health clinic. I do well woman care, I do visits for concerns, I answer a lot of questions, and I also place contraceptive devices, including the Nexplanon device and all IUDs or intrauterine devices.
Good. My name is Mary Landry, and I'm an OBGYN and am the physician who works in women's clinic at UHS. The types of patients that I care for are very similar to Marta, but include women who need colposcopy, which is a procedure where if someone has an abnormal pap smear, that we do diagnostic testing to determine if there needs to be treatment. And we also provide the treatment here at UHS as well. And I also am the provider in clinic who performs ultrasounds to help assess abnormal bleeding or pelvic pain, most often referred to me by the nurse practitioners and nurses in clinic. So, as well as Marta, I'm very busy most days, most weeks, helping with procedures related to contraception, IUDs, as well as Nexplanon.
That's great. You guys do such a wide variety of work, so it's great to have you here today. Kind of going off something that you brought up about colposcopy, one of the questions that we've been getting from some of our viewers via Twitter and Facebook is kind of what is a pap smear and how would somebody know if they should get one?
Okay. Do you want to handle that?
Sure. A pap smear is a screening test, and it is a screening test that's looking for signs of cervical cancer, and the cervix is at the end of the vagina, right at the opening to the uterus. It's a test that we don't do until age 21, regardless of sexual activity prior to that age. At age 21, a pap smear can be done, and it's in the context of a pelvic exam. So you may have had a pelvic exam in the past, and possibly that screening test wasn't collected. And that's a question that I get a lot is, well, I had an exam, I was in urgent care, I was at my pediatrician's office, I must have had a pap smear, right? And the question, or the answer to that question is, I don't know, maybe, but maybe not. Again, it's a screening test for cervical cancer. It's done during a pelvic exam, and we usually don't start it until age 21. Once you've started doing pap smears, if the result comes back normal, it says the cells look normal, then it's indicated every 3 years until age 30. After age 30, the recommendations for women with normal pap smears are a pap test every 5 years.
Great. Do you have anything you wanted to add?
I just wanted to reiterate that 21 is not age that we in College Health have decided is the right age, but it's compliant with national standards. So some women have had pap smears with local providers, and we share with them the evidence behind the recommendations nationally for anyone in the U.S. starting cervical cancer screening by a pap smear at age 21. So that's a very common question that we get if someone has indeed had a pap prior to 21 or at a frequency more often than every 3 years despite being normal.
And that does remind me of another question that I get a lot is, well, I've had all 3 HPV vaccines. Do I really need a pap smear anymore because the vaccine's supposed to protect me from cancer? It's a really common question. It's a good question. And people asking that question, they're not wrong that the vaccine is, the entire purpose is to prevent cervical cancer related to HPV infection. But the vaccine, while very effective, at preventing a small group of HPV infection does not protect against all forms of HPV infection, which is the primary cause of cervical cancer. So despite having had the HPV vaccine, we still do recommend that pap smears be done according to the national recommendations and guidelines that Dr. Landry was referencing.
Another question that I commonly answer will be women who I'm seeing for colposcopy because their pap smear is abnormal. They'll ask me, well, does that mean that I have the infection? And actually the pap smear doesn't test for HPV infection per se, because we don't really care if someone has the infection, because it doesn't change how we care for that person. 80% of women will get HPV at some point in their lifetime. 80% of women will clear that infection within 2 to 3 years. And so we're not really looking to see who's been exposed and who's clearing it, but more importantly, who has had the infection and it's caused a cell change, which is precancerous, and a precancerous change of severe degree that needs management, more frequent follow-up, and sometimes treatment.
Yeah.
So yes and no, the pap smear, they may have HPV, but they may not, and it may simply be that the cells look different for other reasons, and that's what colposcopy sorts out. Is it because there's precancerous change that needs treatment, or is it not?
Yeah, right. So the pap smear is just to make sure that the cells are, doing what they're supposed to be doing, and if there's an HPV vaccine or an HPV infection that caused that, it doesn't really matter. We just want to care for the patient.
Right. Yep.
Right. Great. So let's see. Who can use the Women's Health Clinic at UHS? Who is it open to?
So it's open to anyone who is a student enrolled full-time or even 1 credit at the UW. We care for no faculty. We do care for students who have SHIP insurance and have a spouse, but there's no children of students that are seen at UHS. So it is very much a clinic that's supported by the students, for the students to receive care. And most of that care is provided without any charge.
Mm-hmm. And we see women, we see individuals who identify as women, we see in our associated sexual health clinic, which is physically located with the women's clinic, male visits for sexual infection screening. We'll see anyone who fits the eligibility criteria.
Great.
With concerns.
Great. So another question that we get a lot, and you two do a lot of work with IUDs and other long-term contraception, but people are kind of curious what the IUD insertion is sort of like, and if there's any pain associated with it. People could be a little nervous, so we want to address.
The unknown of the procedure is a huge barrier for a lot of women, and some women come in and talk with us about that so that we can address it one-on-one. But in general, the way that I describe it to patients, and Marta may have a different description, is there are 3 to 4 cramps. The cramps feel like a bad menstrual cramp, but of a degree that makes you want to hold your breath. They last no more than a minute, settle down, and we wait for that cramp to settle down before we move on to the 2nd and 3rd cramp. For some women, if we need to do a little stretching of the cervix, that adds what I call the 4th cramp. But all together, the procedure lasts 5 minutes or less, even with the appropriate allowing a cramp to settle before we cause another one. Ibuprofen helps with the cramps. It takes that peak intensity off the cramp.
Right.
It doesn't make it painless though. So we coach women through nice relaxed breathing, either building on their skill set that they already have, or we coach them through it with good support from the clinic staff. And women understanding what to expect do great.
Right. Yeah. Do you have any other ways of describing the procedure?
That's very similar to the way I would describe it. And in my experience, placing IUDs for women, talking to them after the procedure, saying, yeah, that was similar to how you described it. I talk about the pain being very similar to an intense menstrual cramp. I think one of the good things to remember when you're thinking about voluntarily doing a procedure like IUD insertion, which will provide extremely reliable, low risk and high reward contraception, that the pain associated with placement is temporary. It is temporary. The device gets inserted into the inside of the uterus, which triggers a muscular contraction of the uterus, and that is the sensation of pain. But that muscle is very good at relaxing itself, given time and breath.
So kind of a similar sort of procedural question. People are curious about how STI tests kind of work, what that process is like, and if they have to talk with a doctor before they get one.
Mm-hmm. The answer is no. They don't have to talk with a doctor or a healthcare provider like a nurse practitioner. They can have a visit with a nurse in the clinic, or they can even, if they fit the current criteria here at University Health Services, they can go without an appointment to the lab and do self-collection for chlamydia infection. That is a service that's offered to women who don't have symptoms that they're worried about, that they just want to do screening. But screening for sexually transmitted infections is one of the wonderful services that we provide. And the reason it's called screening is that we recommend testing in the absence of symptoms. So we're screening, or we're looking for something even though you may not have symptoms that say, I wonder if this is an infection I should be worried about. Many times sexually transmitted infections don't have symptoms associated with them, and that's why screening is so important. We can do screening in a lot of different ways. But when we think about sexually transmitted infections, we think about all of these different infections that could potentially be transmitted through sexual contact. And screening is not recommended for all possible infections that are sexually transmitted. Instead, we rely on the research that shows that the most common infections that can be screened or that are transmitted in this population are chlamydia, gonorrhea in some groups, and HIV are the tests that we recommend for screening most commonly. And those can be collected through urine, through vaginal self-swabbing. They can be done in the context of a pelvic exam, but you do not need a pelvic exam to have screening for sexually transmitted infections. And the HIV testing is a blood draw.
Okay.
Great.
So I'll similarly reinforce, like I did with the PAP guidelines, that we follow the CDC recommendations, which is evidence-based as to when it's appropriate to screen and when it's not appropriate to screen. We commonly get asked the question, screen me for everything, can you screen me for everything? I guess would be the question. And we discuss with the patient what risk factors they have based upon their partners and their knowledge of partners and partners' risk. Most commonly, the infections that there's sort of an assumption that we can screen for, but there actually is not an accurate screening test, would be for herpes and also HPV. So there's not a screening test for either of those infections, though if someone has symptoms of those infections, lesions, bumps, sores, or for HPV, an abnormal pap test, then we can do specific testing. But again, that's not really screening. That's because someone has symptoms. So I tell my patients, I would love to screen for herpes if we had a good screening test where, in the context of a patient having no symptoms. But unfortunately, there does not exist anywhere. It's not just UHS, it's not just Wisconsin, it's not just the US, it's in the world. There is not an accurate screening test for asymptomatic patients at relatively low risk for herpes.
Right. All right, so it sounds like the tests kind of depend on what you're looking for, but that it's always good to, talk with your provider about getting some proactive screenings, about ones that we can screen for that maybe you don't have symptoms for yet.
Right. And proactive prevention. So we spend a lot of time talking about how behaviors potentially increase or can be changed to decrease risk. So,
yeah, that's great. Let's see. So this question is about sexual assault. So this person's wondering, are there any resources at the Women's Health Clinic to kind of seek help for that?
Lots of resources.
Absolutely.
So we at UHS are very focused on making sure that we're as proactively as possible addressing students who may have concerns regarding an unwanted sexual encounter, which may or may not be a sexual assault. So we provide open access model in clinical medicine as well as in mental health for someone who identifies having questions, concerns, not sure, or sure that they had an unwanted sexual encounter. And they can walk into the 6th floor first reception desk and identify that need. That's hard to walk in and do sometimes, though we do have very few types of appointments where someone can walk in and we will see them right away. Pregnancy testing would be the other in women's health. So we also offer the opportunity to web book an appointment for unwanted sexual encounter, and we have a completely open schedule for that visit type so that a student can pick the time that works for them, and we will adjust our schedules in the background to make it happen. So we try to have a very open door policy, but also understanding that it's hard to walk through the door, trying to minimize those barriers, which sometimes is as simple as or as hard as saying at a front desk, this is what I'm here for. So web booking works for unwanted sexual encounter and sexual assault at UHS. You'll first be seen typically by a nurse who will understand what the concerns are and help to match our resources in women's health and UHS more broadly with what the patient identifies as needs. It might be a sexual assault that's happened very recently. It might be a sexual assault that's happened months or years ago that they're now identifying some need for support in being cared for.
Right. Yeah, Marta, did you have anything to add?
All of that is true. Another thing I wanted to add is sometimes, if sexual assault has occurred, either recently or in the past, sometimes that conversation comes up not in the women's clinic, but maybe in the primary care clinic. You're there for really bad headaches, and the conversation comes to a place where the patient would like to have that conversation. And I think that it's good for patients to know that all of those services exist throughout University Health Services. So if that comes up in a primary care clinic, the expectation is that they would be able to help you navigate to whatever services you would like to have access to that day. Behavioral health, women's health, we have a direct phone number that they can contact us. Victim services, all of those services are likewise available if the concern comes up in a clinic that isn't the women's health clinic.
Yeah, that's great that it's such an integrated model, and that no matter where a student may find themselves in the clinic, whether it's on the 5th floor or the 8th floor, that they're going to have someone that knows how to help them and can refer them to the right resources and services.
And I'll also reiterate that all care that's provided at UHS is confidential, and particularly in the context of trauma. We remind patients, but I will at this point also say explicitly that the care is completely confidential. It doesn't need to go any further than the context with that provider that it's brought up, if that's what the student needs at that point. But if more services are what the student identifies as being helpful to them, either now or in the future, we provide that student with those resources. But again, completely confidential, just like any provider-patient interaction, completely confidential, unless the patient asks for services that might bring it to the attention of others.
Yep. And that's true even with reporting to law enforcement or kind of going down those roads that can sometimes feel like a barrier to victims of sexual assault. Simply having the conversation is really just that, simply having the conversation. Any additional resources, connection to community resources, resources within University Health Services are entirely optional and can be accessed at that time, can be accessed later, can be accessed never. It's entirely up to the student.
Let's see. So this switch topics a little bit back to contraception. We have another question about sort of the other uses of birth control. And this student wants to know, will birth control and taking hormonal birth control help with acne and cramps? So,
Go for it.
Well, that's a big question. It's a good question. When we think about birth control, we're thinking about controlling birth. It's a contraceptive. It's a way to prevent pregnancy. And there's a lot of different ways to prevent pregnancy. And things that I think fall under the definition of birth control include things like the Nexplanon device, which can be inserted under the skin of the upper inner arm in a woman, the intrauterine device or the IUD. Birth control pills, the NuvaRing, a patch that delivers the same medications. All of these things can be called birth control, including condoms. But if we're talking about hormonal birth control or anything that delivers a hormone to a woman's body to help prevent pregnancy would be things like the birth control pill, the NuvaRing, the birth control patch, and there are some IUDs that have locally acting hormone on them. If someone comes in saying, I've heard that birth control can help me with concerns like cramps, like acne, then the things that might work in those situations would be the birth control pill, and some women experience improvement in those concerns with the patch or the ring, and particularly with cramps, with the hormonal IUDs. But everyone does have sort of a personalized response to these medications. Research would say that birth control pills are one of the most effective ways to treat painful periods, to treat hormone-related acne, cyclic acne, but not all pills are the same. Not all women are the same, and not all responses to pills that, according to research, should work is the same. So, yes, it is worth trying, and it is. There are non-contraceptive benefits to these devices that are absolutely worth exploring. I place IUDs all the time in women who aren't using them to prevent pregnancy as their primary concern, but instead would like to have a shorter or lighter, less disruptive, or less painful period. I prescribe birth control pills all the time after conversations with women who are looking to control acne related to their periods or control their periods themselves, heavy bleeding, painful bleeding. And just like any medication, the conversation is worth having because there are some women with health concerns that would prevent them from safely using particularly birth control pills. So that conversation helps us identify, is this safe for you? Do you understand what the side effects could be? And what the benefits are that you're looking for? But the answer, sort of after all of that, is yes. There are non-contraceptive benefits to contraception, and particularly for cramps and for acne.
So, additionally, and very common requests that we have is assistance with those concerns. But then there's also women who carry a diagnosis of endometriosis and using hormonal contraception, either systemically with all the methods that Marta described, as well as the local progesterone of IUDs, very effective when I'm trying to help manage endometriosis, preventing surgery, preventing need for recurrent surgery to control pain. We also use it commonly for women who have severely heavy periods, what we call menorrhagia, that causes them to be anemic, from sometimes conditions that are related to the uterus, structural issues, and oftentimes not. We also use birth control, including IUDs, as well as the pills, the patch, the ring, to help to decrease a woman's lifetime risk of cancers. So probably most importantly and most least understood, is that birth control pills have been shown in women who have a familial tendency towards ovarian cancer, as well as for women who don't have a family tendency towards ovarian cancer, that being on birth control pills for up to 5 years can reduce your lifetime risk of ovarian cancer by 50%. Now that doesn't mean that in college that's the right time
Right.
to use birth control pills if it's challenging, which it commonly is, for women to remember to take a pill reliably so it's effective for them to prevent pregnancy or to control their symptoms. But at some point in their lifetime, to reduce the risk of ovarian cancer, we strongly, women's health providers strongly recommend that women consider, if medically it's safe, to go on birth control pills at some point in their reproductive lifespan to help reduce that ovarian cancer risk. It's about a 1 to 2% risk that we all carry. For women who have a family tendency towards ovarian cancer, it's much higher. But a 1 to 2% chance of a cancer that we do a very poor job of diagnosing early enough to allow effective treatment that saves lives. So if we can prevent a cancer, kind of like the HPV vaccine, prevent the cancer by preventing the infection, we're all about that. But in the context of busy college lives, days and nights not always consistent enough to consistently take a pill. Sometimes the long-acting methods, what we call the LARCs, the IUDs and Explanon, are preferred to help to control symptoms and or prevent pregnancy. Other cancers, endometrial cancer is reduced by the hormonal birth control that carries progesterone, so essentially all of them, other than the copper IUD and condoms. And then there's also a reduction in the risk of colon cancer with hormonal birth control. So those would be the other reasons beyond the acne and bad cramps, which are definitely the most common.
So, kind of bottom line, there's a lot of different benefits to birth control that go beyond just being a contraceptive to prevent pregnancy, and women use them for a lot of different reasons.
Oh yeah.
Yeah,
Definitely.
that's great. Well, it looks like we're coming up on the end of our time here. So we will bid our viewers goodbye. And thank you so much for tuning in. And the Women's Health Clinic is here for you if you would like to schedule an appointment.
Great.
Okay.
Have a
Thank
great
you.
day.
Bye.
Thank you.